Are you getting claim denials even when your services are medically necessary? The problem might not be your treatment, it might be your documentation. In this video, we'll break down how documentation directly affects billing, reimbursement, compliance, and claim approvals. Why documentation matters in medical billing. Documentation is the foundation of every claim you submit. Insurance companies don't just pay based on what you did, they pay based on what you documented. If it's not written in the medical record, it technically didn't happen from a billing perspective. That's why even small documentation gaps can lead to denials or underpayments. How documentation impacts billing. Let's break down exactly how documentation affects your revenue cycle. 1. Claim approvals versus denials. Clear documentation supports medical necessity. Missing details often lead to automatic denials. 2. Level of service, EDM coding. The complexity of your documentation determines whether you bill a low, moderate, or high-level visit. Weak documentation can force down coding. 3. Medical necessity validation. Insurance companies use your notes to decide whether the service was needed. If justification is missing, the claim is denied, even if the treatment was appropriate. 4. Audit risk. Poor or inconsistent documentation increases audit risk. Auditors look for patterns of unsupported billing. 5. Delayed payments. Incomplete notes often trigger manual review, slowing down reimbursements. 6. Revenue leakage. Underdocumentation leads to undercoding, meaning you may be doing higher-level work but getting paid for lower-level services. Key documentation elements that affect billing. To ensure clean claims, your documentation must include clear diagnosis and medical necessity, detailed history and clinical findings, time spent, when applicable for time-based codes, procedures performed with specificity, patient response and treatment plan, provider signature and credentials. Light bulb pro tip, vague notes like, patient seen and treated are a major cause of claim rejection. Real-world example. For example, two providers may perform the same service, but the one with detailed documentation including history, decision-making, and treatment justification is more likely to get paid at the correct level, while the other may face denial or downcoding. Strong documentation is not just a clinical requirement, it's a financial tool. Better documentation means fewer denials, faster payments, and higher reimbursement accuracy. If you're a provider or practice struggling with documentation issues, coding accuracy, or claim denials, ZenMD can help. At ZenMD, we provide end-to-end medical billing and credentialing services designed to maximize reimbursements, reduce denials, and streamline your revenue cycle so you can focus on patient care. Reach out to ZenMD today and let us handle your billing the right way. Scan QR code to schedule a meeting or visit our website.